Good afternoon. Can you all hear me? Wonderful. I think we just make a start. People keep coming in. We've got 1 hour, so no time to lose. And I can already start talking whilst people come in. So it is my great pleasure to welcome you to this first parallel session. My name is Peter Loffler. I work in the European Commission in the Climate Action Director General. And if you listened to the panel discussion and our director, Kurt van den Berge, you know why we place so much importance of working together with many other colleagues from the Commission and many other organizations on the climate and health agenda. We have learned this morning already that the health impacts of climate change come in many different flavors and shapes and colors. But this session is on the heat and heat-related impacts and the dimension of non-communicable diseases. Of all climate-related health impacts, I guess heat stands out for being sort of the most direct, most imminent impact. And we do speak of global warming. It is very significant. We heard about the 60,000 plus deaths caused by the heat stress in the year 2022, the fast rise in heat stress, and it affects all world regions. The health minister of Malawi spoke of the very hot conditions in her country, hotter than here, even though it's unusually warm here. And here in Europe, well, whilst we may have sort of very capable health and care systems, this is a continent which is warming twice as fast as other world regions. We also have an aging population in Europe, hence a fairly high incidence of non-communicable diseases, and that is a risk factor. And we have worrying studies pointing to the very fast increasing risk of getting heat waves with temperatures in excess of 50 degrees Celsius in the Mediterranean regions. So this is a big worry. And of course, what we learned also this morning is, and this is, I think, true for all countries and all regions, like many impacts of climate change, the most vulnerable are the most at risk. So we have sort of this equity dimension, which Rebecca Grace focused in her talk. So we do know a lot about heat and health already, but you never know enough. We want to discuss today where we stand with heat health, and in particular also what research should be doing next, what we need to concentrate on in the years to come. And to do so, and my role is really to let my speakers to shine. We have a fabulous panel here with Vladimir Kendrovski from the WHO Europe office, Andreas Flouris from the University of Thessaly here sitting next to me, Gloria Maimela from the WITS RHI University of Witwatersrand in South Africa, and Caroline Hickman from University of Bath. And so I think without further ado, we will start with a first session where our 4 speakers give sort of some intro talks. We will then move on to some sort of dialogue between myself and our panelists. And in the last quarter of an hour, we open the debate to everyone. We will do this again with Slido. So if you do have smart, interesting questions, keep, put a pin in them. And when the Slido link pops up, do send them to Slido so that we can ask them in that last part of the session. Without further ado, I'm going to move to our first panelist, Vladimir Kendrovski. He works as a technical officer for climate and health at the World Health Organization's Regional Office for Europe. Vladimir is an expert. He advises WHO Europe member states, provides them with his technical expertise, and particularly also assists them in developing and helping and implementing policies on heat health. And Vladimir, I give you the floor to.
Can you hear me? Yes. Okay. Thanks a lot, Peter, and good afternoon, everyone. Thank you for having me today, because I'm really thrilled that I participate in such fora for discussion, taking into account the importance of the topic. I will start probably from point of WHO about the non-communicable diseases, because this is the diseases we are faced with, the epidemic of these diseases Globally, 74% of all deaths, more than 40 million, are due to non-communicable diseases. And this including cardiovascular diseases, chronic respiratory diseases, cancer, diabetes, and others. But when we come to the European region, which consists of 53 member states, we are talking about 90%. And there are no good news for the future. We know that due to urbanization and the aging, our population in Europe will be more exposed to non-communicable diseases from one point. But from another one, we are talking about the more extreme events we are faced due to human-induced climate change, as we heard from the previous speakers. So there are huge public health importance because the heat waves and the heat kills. We call it silent killer because we don't know the names of the people who die. But we heard that it's killed a lot. Just in 2022, we heard in 35 member states more than 60,000 people die. And this is the most vulnerable one, the elderly, the ones with the pre-existing condition. And that's why it's important for public health, for WHO, for all to find a way how we can prevent this issue. And I think that in the forthcoming discussion, we'll have possibilities to go in details about the potential risk. Because we in WHO, in European Centre on Environment and Health, which we consider as a center of scientific evidence in the WHO European region, which provide to member states the information about the emerging and ongoing environmental risk, we intend to address this risk and to support countries to find and implement policy which can reduce this risk. And this is the role of WHO. Thank you very much.
Lovely. Thank you very much for your introductory statement, Vladimir. And yeah, absolutely well done on timekeeping. I think we're catching up fast. So heat is the silent killer, and I guess, how can we break that silence? Big question. Maybe with that question in mind, I can give the floor already to our next speaker and introduce Dr. Andreas Flouris to us. Andreas is a professor of physiology at the University of Thessaly in Greece. He is also a visiting professor at the University of Ottawa in He has led a number of international projects, has published widely on these topics. His specialty, if I can call it so, is to some degree occupational and heat stress, where he advised the new legislation in Qatar. And he is also advising the World Health Organization, the International Labour Organization, and the EU Advisory Committee for Safety, Hygiene, and Health Protection at Work. Andreas, the floor is yours. And thanks for being with us.
And thank you very much for inviting and for organizing this important session. Esteemed colleagues, it is a great pleasure to be here. And as we gather today to address climate change, I want to bring your attention to a topic that I feel is both urgent and deeply human. Imagine the lives of European workers where every day under the scorching heat, they have to not only endure the discomfort of working in a hot environment, but it's also about navigating into a minefield of health risks and productivity losses. This is a reality where hundreds of, at least in Europe, hundreds of occupational heat illnesses are happening every year. And this is not just a statistic, it's stories of pain, stories of disruption, and stories of often irreversible loss. In the last decade, we have been working very hard in Europe to gather the needed evidence, and the numbers speak volumes. This slide talks about the health impacts, and the European workers, every single day from May to September each year, face 518 28 occupational injuries caused by heat stress. Also, there are 36 moderate and 4 severe cases of heat injury every day. And the problem is that many of these workers will experience problems in their health that are irreversible, and they may never recover from them. Even worse, every 2 days in Europe, there's one fatality that is related to occupational heat stress. This is the present, but unfortunately the future is even worse because the trend, as we all know, is rising due to climate change. And this highlights the gap. It's a call to action that highlights the gap between the existing public health policies that we have and the challenges, the rising challenges that the workers are facing because of climate change and mainly because of occupational heat stress. At the same time, we are faced with a parallel crisis, the economic burden of productivity losses due to occupational heat stress. The European economy is bleeding currently 5.5 billion euros every single day during the hot part of the year because of productivity losses due to climate change. And this is projected to increase to 26 billion euros a day by 2060. And this is not just an economic forecast, it's a warning that if we don't take immediate and decisive action, the very fabric of our economy, as well as the health care of our workers, the welfare of our workers, will suffer irreparable loss. Identifying those at risk and investing in effective policies to protect them is not just something that we have to do, it's not just our duty, is a wise economic decision. So in conclusion, to not take too much of your time, I think the data that we have, at least in Europe, but also in many other parts of the world now, is irrefutable. In my view, the biggest danger from heat in the coming years is not abstract, it's quite specific. It is the health and the productivity of our workers. We need to address this, and we need to take action now. WHO has, as Victor just told us, they have laid an important foundational framework to address this at a public health perspective. We need to do the same for workers because the scale of the problem and also the challenges that they face are so specific that we need to do this. We need to devise specific and targeted interventions to protect them. And of course, by extension, protecting our future. Thank you very much.
Andreas, thank you so much for breaking the silence of the silent killer. 528 injuries per day, 5.4 billion euros per day. And I can tell you that politicians are listening a lot to these figures. You spoke about Europe. Our next speaker, Gloria Maimela, will give us a wider look because she works, as I said before, in South Africa. Gloria oversees the donor-funded climate change and health practices at WITS RHI. She is the local principal investigator of the European Union and Wellcome Trust-funded climate change and health projects. She is also one of the principal investigators of the Heat and Health in Africa Transdisciplinary Center research, and she is a member of the Climate and Health Africa Network for Collaboration and Engagement. Gloria, I'm sure you have a lot to share with us. The floor is yours.
Thank you very much. And thank you for the opportunity to come and speak. Hello? Is that better? Okay. Yeah, thank you very much for the opportunity to come and speak at this conference. As you say, I'm from South Africa and I co-lead some of the studies on heat adaptation in pregnant women. But today I'm going to speak on climate change and non-communicable diseases from a context of resource-constrained countries. So I've got the one slide that tries to capture it all. If you look at the burden of NCDs in Africa, 80% of global NCD deaths actually occur in low middle income countries. And of those 80%, a third of the deaths occur in sub-Saharan Africa. I mean, recent data from South African literature shows that in the past 10 years, there's been an increase, up to 60% increase in a number of NCDs as the past 10 years. And so this is, becoming a bigger and bigger problem in Africa than before. And what we are seeing is what we call an epidemiological shift from commonly, infectious diseases to NCDs. And so a lot has been said about South Africa, about Africa and HIV and tuberculosis, but the biggest problem now that we are seeing is NCDs, and we're talking specifically about climate-sensitive NCDs. So this epidemiological transition is happening because of lifestyle diet that is largely imposed by climate change. And as we all know, that the rising ambient temperature, are going up and up, but sub-Saharan Africa is disproportionately affected and has less resources to cope with the impact of climate change. We're seeing rapid, and one of the contributing factors is rapid urbanization. And we're seeing that in the past 10 years, there's been a 3.6% growth rate in urbanization in African countries. And although there are many factors to urbanization, a lot of it has to do with social and economic factors, but we also see migration as a result of climate change that is compounding the problem. And the risk here is that you're getting people move, could be for economic reasons, from predominantly rural areas into urban areas, only to land up in what we call informal settlements. And we know that of people in urban areas, over 72% in sub-Saharan Africa live in informal settlements. And with that comes the rise in what we call urban heat islands. And so they're moving from green areas into informal settlements, and that is compounding exposure to heat. And as we're seeing that there's a rise in climate-sensitive NCDs as a result of climate change. And the risk, just to quantify the risk is a factor of exposure. So we are seeing in these regions high ambient temperatures, heat waves, wildfires. We cannot also ignore the role of air pollution in the rise in NCDs. But then the vulnerability, extremes of age, people with pre-existing medical conditions, including pregnancy, which is largely the body of my work, and we're seeing pregnancy-induced hypertension and gestational diabetes in pregnant women because of heat exposure. We talked about outdoor workers and malnutrition, and more from the obese side of things as a result of poor diets. And then obviously you can't talk about low middle income countries or sub-Saharan Africa without talking about inequity, which is the driver of most of the challenges that we're seeing. And that inequity is because of lack of adaptation resources, poor infrastructure, access to healthy diets, and also overburdened health systems. So as much as you've seen the burden increase, the capacity of the health systems to in this impact is actually also diminishing. So now's the time to invest more in African regions and start addressing the issue of non-communicable diseases as a result of climate change. Thank you.
Gloria, thank you very much for your talk and for making us aware of what is a challenging situation indeed. And I think I can quite easily see many of the themes which we touched already upon in the plenary session coming up here, and that we need to discuss a bit how to address the situation. But before we do that, our last lecturer has already taken the lecture. Wonderful, Caroline, for making up 10 seconds. So this is Dr. Caroline Hickman. She is a lecturer in the Department of Social and Policy Science at the University of Bath, and, as I learned, a postgraduate research student in the Department of Education and Physiotherapist in private practice. So that is a wonderful combination. Caroline, you've been researching physiological impact of climate change on children and young people internationally for 10 years. Psychological, not physiological, but I think you will make that argument. Sorry for that. And you were the co-author of a 2021 quantitative global study on 10,000 children and young people's emotions and thoughts about climate change. And so your point is really the mental health impacts of climate change, which Sandra Galina also mentioned before at the plenary and said we don't have this enough in our sites. Caroline, the floor is yours. No slides for you? Is that what you're saying?
And I broke all the rules. They said 2 slides, I sent 4. Because I can't remember the data. I was going to give you numbers, people. No slides. Okay.
Caroline, shall we, if you need your slides to give your talk,
I will. Sorry?
you will need your slides, right?
No, we can manage.
You will manage?
We'll manage.
You are wonderful. Very sorry for that.
You will have to let me ramble a little, though, to try and...
Just open your heart, Caroline.
I'm going to...
And
don't ask me to do this in 3 minutes without slides. Okay, right. Challenge. So, mental health impact of heat on climate change. The data shows us we've got 3 significant impacts. Suicide, increase in suicide numbers, and suicidal behavior, which is self-harm.
Caroline, it was great. I mean, in my field, in adaptation policy, we always speak about adaptive capacity and resilience, and I think you've shown that. And I don't know about the others, but I almost saw your slides whilst you were talking, so it doesn't always require slides. Thank you very much, and sorry again for the glitch with the slides. We'll try and make it up. We move now to sort of a bit of an interactive exchange between the five of us. Before then we go to Slido. So if you do have already some things that interest you, some questions that you would like to ask, please do post them on Slido. You see the code here. But before we go to that, let me just do one 15-minute round of back and forth between myself and our panelists, and we go by the same order. Vladimir, it doesn't really. Why do we need to step up policy and action? I think it seems an obvious thing, but maybe there is more to it. So once again, on heat health, why, from a WHO perspective, do we need to step up policy and action on heat health? And what are you doing to support your countries?
I'm still impressed from Caroline how he brings the real life situation to us. So even we. In WHO's international organization works probably in silo in the very big distance with the reality, but I hope that it's not the case because we are a research institution and our mandate is also to bridge the gaps between the countries. So in order to propose any actionable policy, we have to have quite evidence. And for example, maybe you know or not, but we published our heat health action guidelines in 2008. Because of climate change, in the last 2.5 decades, we face in European region with 3 mega heat waves, which will never appear without human-induced climate change. So because of this, and it was Paris, you probably all know, 2003, more than 75,000 deaths. Then we have eastern part of Europe, 2010 and 2022. Even in between, some regional fact. But what is the fact? The fact is that in the last 5 decades, we have increased of 5 times the number of extreme weather events, and the heat waves are the most deadliest. The heat kills, as I said. And that's why we also conduct 5-year surveys with systematic literature review, with involvement of many experts globally, because even we are talking about WHO European region, these guidelines has global relevance. And I'm very happy that the European Commission and WHO in partnership work in the previous guideline and now on the update, which will probably be, which will definitely be finished next year. So in this gap of 18 years, we collect a lot of evidence about the efficiency of the heat health action plans among 22 countries we have in the region, based on the core elements of this, and to try to see what is work, what is not work, but based on the evidence. And I'm very thankful to Andreas, who support us and put a lot of emphasis this book of evidence on the occupational health, which was not previously a case. So now we are working to manage, to finalize, because we know that the prevention is key, that this is the mostly, not all, but mostly of these deaths are preventable, and with adequate communication, awareness, and promotional campaign, we can, at the different levels, the country, federal, country levels, local levels, we can engage many other sectors to break the silos, like early warnings with the meteo service. We can work together with emergency. We can work together with the social departments, but also with civil society, and also, as we heard again with the beautiful slide I saw, with the mental health, because we are not talking anymore about their health only, or even well-being. Now we would like to introduce the third component, which is equity. So this is, in fact, something we are working on, and for this, the support we get for our partners at the international level and the EU level is with paramount interest. Thank you.
Thank you very much, Vladimir. So, action is needed. Caroline also made the case, and then if it were, to address also this sort of sense of betrayal and frustration of the people who are suffering mentally from climate change. You made, I think, a clear case here. Turning to Andreas, and when we have been speaking about the EU climate risk assessment and the communication which we're putting out soon of the Commission on what we're going to do about the EU climate risk assessment's finding. And then there's always this thing about prioritizing, what is really the biggest thing, the most efficient thing to do. Now you've done all the number crunching, you presented some really impressive numbers. But if really Europe was to focus all its efforts on addressing one problem caused by heat, what should that be from your point of view? What's the, in your view, what is the single biggest priority right now? Do you have an answer on that?
Well, obviously I'm a bit biased here. I showed my cards earlier. For me, the single, if we had to put all our cards into one place, that would be occupational heat stress or workplace heat stress. And the reason is because there has been a lot of work. I know there's still much to be done, but organizations such as the WHO, Ministries of Health, researchers, NGOs have done so much work in terms of the public health aspect. Of course, like I said, we still need to do a lot of work, but there's nearly none in occupational heat stress. I don't know if you noticed one of the slides that Andy Haynes showed earlier today. He showed a map where data had been gathered, and next to it there was a graph that showed the different areas. Mental health also almost non-existent. There was a little bit of occupational health there. It was almost like a hairline of data there. So there's almost non-existent. The good news is that it's changing rapidly. The last decade or so, we have been gathering a lot of evidence, but we were doing a report with the International Labour Organization, and we did a survey across the world, and there are 20 countries in the world that have legislation that to some extent tries to protect workers. And most of these countries use relatively good evidence. Some of them use no evidence. It's just random sort of mitigation strategies. There's no early warning systems across the world. As Andy Haynes also showed, there's almost 90% of the work done on impact, very little done on assessment, on strategies and on implementation, and solutions and implementation. So there's so much work to be done, and also this group is probably the biggest part of the population in terms of size that's exposed to heat. And also it's not easy to address the problem with workers, because in the general population you can just say, go to a cool building in a library or something. You cannot say that to a worker. The worker has to stay, or at least to some level maintain productivity. So it's a very complex topic. It affects also the economy very much. So I really think we need to address it, and there's very little work done so far.
So if I understand you correctly, we really don't have the evidence needed to develop effective solutions right now, in your view. Is that something you would recommend sort of the EU-funded research also to focus on?
Well, we have the situation, especially in Europe, has been, if you asked me the same question 10 years ago, I would say we have almost no evidence, almost zero. I think there was 2 studies or 3 studies in the history of Europe 10 years ago. Now, things have changed dramatically. I would say that Europe is probably the champion in this field, but still there's a lot of work to be done. Most of it has been done on impact so far, and we need to move forward with solutions, and we need to move forward with implementation, and early warning systems and many other things to tackle. So there is a lot of evidence that has been gathered. So I think we can start discussing how we can protect workers, maybe at a legislative level. There is the evidence there, and it's building very rapidly. So because I know that policy processes take a while, we definitely need to start that. And I was happy to see that the European Commission has initiated a committee on this, and I was happy to also be invited to participate last November. And it's a committee on occupational health and safety to advise the European Commission and the European Council towards, hopefully, in my view, to lead towards legislation in the future. But I know for sure that it will take at least a few years. So I'm sure that by then we'll have a lot more to discuss.
Moving from research to action. Thank you very much. And thanks very much for bringing that out more clearly. And it's quite interesting to listening to Vladimir and yourself. I think there's sort of this more actionable component now, this evidence, solutions, interventions. And that brings me really to Gloria here. So far we've been speaking about Europe, but I think the point which you made, and you brought out the challenges which you're seeing in your projects. Here we have more resource-constrained settings, and these are, some of the solutions that we may be discussing in Europe, maybe out of the reach in the settings which you're working on. Yeah. So, are there any interventions at the community level or also at the national level that, in those settings, one could prepare to protect people with non-communicable diseases from heat-related stresses? Yeah. And what is it that that you're working on?
Thanks, Peter. I think, from an LMRC perspective, you need to start thinking about transformative systems approach to adaptation intervention. It cannot just be, you can't take it for granted that people have access to aircon, which is on its own a maladaptive response. You can't take it, for granted that people have access to water, which is problematic. So, my team and I developed what we call an interventions framework that we can use to kind of like rethink about where to start. And for LMRCs, you talk about community level interventions, policy level interventions, and health systems interventions. For example, with community level interventions, things like community cooling spots, especially for people who are living in informal settlements that are dense. So if you could, find places where people can actually go and cool off. And including outdoor workers. I mean, we see that a lot, that could be very effective. Community watering holes, if you can get people, people can access water to cool themselves off, that's one of the things that you could implement. But you also, you need to rethink urban spatial planning. If we're having people move, to, for example, informal settlements, maybe you need to bring in the urban planners to rethink about nature-based solutions in those areas. For example, urban greening could be a solution. Gardening, gardening brings in the greening phenomenon, but also in terms of nutrition, that could be a healthy approach that could also address NCDs. I've seen in certain areas, also informal settlements, what we call recreation centers. Nice centers where you can actually have, exercise equipment that are there, that are built in, to make sure that they don't get stolen, that people can access on a regular basis to exercise. So it's not that people don't want to exercise; they just don't have the means and the resources that they can use to exercise. So perhaps if you put these around these centers as part of redesigning those informal settlements, that would help. Another, intervention could be, redesigning or decentralizing access to care, because you have the people who, as we said, the health systems have taken a hit. We saw with COVID-19 what happened to health systems, particularly in Africa, and now we have the impact of climate change that's also increasing the burden, and therefore to start thinking around where else can people access their medication. So people who are diabetic, where do they access insulin? Do they have to walk all the way to the clinic? And talking about such drugs, we know that as temperatures increase, those drugs become unstable, and so are there ways that we can find we can decentralize so that, and also think about value chain systems and cooling systems that we can use to make sure that stability to medication is enhanced. Early warning systems, one can never talk about that enough. I think that's warning people about the impending doom, but also coupling that with messaging around where to go, what to do, being able to say to them there's a cooling spot at place X that you could access in case there's trouble, but also access to emergency care. Are some of the things that we could also be thinking about. I cannot underscore the need to tap into indigenous knowledge. I mean, someone I think today said people have long lived in these areas and have somehow, to some extent, adapted to changing climate. And therefore, it could be just tapping into that knowledge and see what it is that people do to try and cope with heat could also be helpful. But also the role of surveillance, because one of the problems is as much as we've collected data on, for example, infectious diseases, we haven't really collected a lot of data on NCDs, at least from the places that I've seen. So being able to quantify and understand what the burden is, but also being able to stratify and to determine who's at most risk so that you can target people who are at a high risk from a preventative and also from a curative perspective. With all these interventions, I think Andy mentioned that in the plenary, that it's important to evaluate the effectiveness of these interventions, even at community level, at policy level, because it's great to say drink water, but how effective is that? We need to know. And also in LMRCs, the cost effectiveness of this intervention is key. Yeah, thank you.
Many different things that we need to do. I guess that's the argument. And those things do not necessarily have to be very expensive. The important thing is, I think, to do them all and to do them in a systematic way. That reminds me of one of our key headings in the EU strategy on adaptation to climate change. Systematic adaptation is one of the big mantras, to do many different things at the same time, to have the best level of protection. So thank you very much for that. We move to Caroline once again on mental health issues. And my question to you would be, we have physical impacts and psychological impacts, but how could we develop research to bring the two together?
Is that on now? It is on. Excellent. Not a day for technology. I think this discussion and this panel is a very good illustration of what we should be doing, because if you had asked me the questions that you asked my colleagues, I wouldn't have a clue how to answer that. But I could give them insights, valuable insights about psychological barriers, about psychological defenses, about how to communicate with the population, how to expand a psychoeducational program for people. That would be a way of integrating. One of the problems with mental health research is it's less tangible, it's less measurable than the physiological research. But one of the things I like to think about is the importance of the internal research, internal activism, internal actions, as well as the external. And my colleagues are brilliant at the external, but I could bring the internal, because we can't divide physical and mental health. They are interrelated completely.
Super. Thank you very much for sharing your thoughts on that. And yes, this is a tricky subject, difficult. Right, as it happens in these panels, we're getting a bit squeezed for the open exchange part, and I'm looking on the screen to see whether we get anything from Slido. Wonderful, there are questions, and we've got about 12-13 minutes to answer them. Question to Professor Flouris: could you shed some light on the occupations that are most affected by climate change, heat stress?
Thank you. That's a very important and often discussed question. If you look in the literature and some of the large reports from WHO, ILO, they would tell you, which is true to most extent, that the most impacted occupations are agriculture and construction. Beyond those, of course, there are a range of others. There's nearly no occupation that is immune to it. Interestingly enough, one thing I forgot to say in my presentation was that, for example, we knew that heat stress impacts productivity, But previous models that existed 10 years ago and before that assumed that if temperature stayed below 27 degrees Celsius, there was zero impact on productivity, zero. So there was almost no issues. Same thing more or less with heat, with health. But what we have been seeing by being able to go to the field and collecting data from thousands of workers is that the impacts are starting to emerge all the way from 15 degrees Celsius and up. And from every degree Celsius from 15 and up, there's a 2% decline in productivity. And this also mirrors almost perfectly the rise in occupational injuries that start to emerge from 14 to 15 degrees Celsius and up. This means that nearly no occupational is immune to it, and also no country is immune to it. As we discussed earlier in the previous sessions, Central Europe is certainly not immune. There's no country that doesn't have at least 15 degrees Celsius in the summer, and almost no profession that doesn't expose workers to 15 degrees Celsius. So occupational is agriculture, construction, then mining, manufacturing, tourism also, food and beverage. In the kitchens we see a lot of exposure. Anything beyond 15 degrees Celsius is at risk. Keep doing that, sorry.
Thank you. Yeah. Microphones technique. Thank you very much for this answer. I move on to the next question, which again was very popular. Oh, I got 11 supporters now. How can we sensitize vulnerable groups for heat stress, especially persons who might be young and healthy and not so aware of the risk, like, for instance, pregnant women? And of our four panelists, who has... Gloria, I see your hand moving to the microphone.
I can talk about pregnant women because, you know, we're doing a lot of studies on that. And the most important thing is raising awareness. Yeah, so we found that to be quite impactful. Just and that can lead to behavioral change. There have been studies that we've conducted by my colleague over there, Matthew Chesik, around how just informing women and their families about the risk of heat exposure on their pregnancies led to behavioral changes to protect the baby, not only just for the women, but also for their partners and family members who suddenly were aware of the risks of heat exposure. The early warning systems, as I said, through the High Horizons project, we're working on early warning systems coupled with messaging. Again, and we just recently conducted a photo voice study where we actually went to women and asked them to take pictures of their surroundings and talk about how heat impacts on their well-being. And that already was, we're getting powerful messaging coming from women and certainly being aware and urging urgent action to protect them from the impacts of heat exposure. So, yeah.
So thank you. Yeah, awareness. Oh, I wasn't aware before, and now that I am aware, I read about it and learn about it. Anyone else who wants to come in? Andreas?
Thank you. I totally agree with Gloria, but another issue that I think is not enough known is the fact that very often, at least with workers, we see young, healthy individuals experiencing heat stroke, and issues, very serious complications like chronic kidney disease. So, for example, in places like Nicaragua or in many countries in Central America and also Southeast Asia, we see younger people between 15 and 30 years of age developing very serious conditions such as chronic kidney disease or heat stroke, and they are perfectly healthy and they still experience this. Also, very often we see that people that experience heat stroke during work or during any kind of physical activity, whether that's recreation or housework or anything related to physical activity, they are perfectly healthy. They are doing the same thing as somebody else is doing right next to them, but they, for some reason, that particular day, they happen to be at a specific risk. We're still trying to understand why. So it's important to understand that heat is a silent killer and does not often give warnings. So everybody should be aware of the issues, whether they are a vulnerable population, considered vulnerable or not.
Thank you very much, Andreas. I switch immediately to Vladimir, who wanted to weigh in.
definitely we did in our book of evidence systematic literature review, the exposure on the pregnant woman and the heat and the intervention, which is probably more interesting for this audience because there are only few cases where we found that due to early warnings of the potential heat waves, the pregnant woman are released from their working obligation. So this is one of the way how it can be seen due to, but this is again, it's up to many consideration because this apply only for governmental sector, not for the private sector in the countries. They use this recommendation. And then again, the issue of equity and others is here. But what I would like to highlight is that, sorry, okay.
I didn't want to cut you short. No, we just exchanged that we've got 4 minutes left. But all good. I've got maybe one last question.
Okay.
I've got one last question. This is a really interesting one with maybe, asking for a short answer if you have one. Are there any political interventions that could mitigate the urban heat island effects? Not technical, political.
Yeah, yes. But not technical, but political is agreement of the local government, definitely to start to think about to take care about the citizens, because creating it can be short or long term, creating parks or blue and green spaces is definitely one of the potential. But here we have to be more mindful in to see the big complexity of the issue, because here we are talking about the housing standard, we are talking about the working environment, we are talking about, so there are many other possibilities, but for me, political intervention will be to break the silos, start to work together, and definitely urban planning and long-term strategy is one of these favorite political issue.
I just wanted to add that, in South Africa, we have elections that are upcoming, around the corner. And someone said, actually, we should make sure that politicians include climate change in their manifesto. And that way we can, vote for them if they have a concrete plan on how to address climate change. Yeah.
Very clear answers. Thank you very much for that. We've got 2 minutes left. So not much time left. I think at this point, and I took a couple of notes here. I think what we managed to do with this. With so many different capacities and so many different viewpoints and coming from different world regions. And to me, that was actually also, it emerged from this discussion that time has come for action. Action needs to be systematic, it needs to be systemic, it needs to be comprehensive, it needs to be interdisciplinary. And I thought from that point of view, we had a really, really interesting panel in the room. So there isn't really much left for me to do than thanking again our 4 panelists and everyone else in the room for listening and for coming in with your questions. I hope you found it interesting, and we look forward to seeing you then in the plenary session, which is now upstairs. Thank you.